Good afternoon, Mike Jones, Fire Chief, City of Fredericksburg. Let's talk a little bit about COVID-19 and an update for the city in relationship to the new executive order that has been produced by Governor Northam's office. First, the statistics. As of today, there are 1,381 positive cases in the local health district, which includes the 4 counties in the city of Fredericksburg. The city of Fredericksburg itself has 135 of those cases, and there were 28 new cases in the health district since last night. We now have a total of 16 people that have perished from COVID-19 in the health district, none as of yesterday, and we had no new cases in Fredericksburg as of yesterday. Stafford now has 657 cases, Spotsylvania 474, King George 60, and Caroline County at 55. Testing continues to increase. We've tested almost 200, or a little bit over 275,000 individuals in the Commonwealth since the beginning. The actual positivity rate, or the number of people that come back positive versus total testing, is somewhere right under 14%. So the numbers are coming down and trending down a little bit. It's the same case in the health district, as we are slightly under 14% as well for those tests. We've tested a little bit over 9,000 people in the health district since the beginning, so we're moving forward there. We'll put the other statistics up on our webpage when we put the written report up. Let's talk a little bit, and I think a lot of people have concerns about the executive order that came out yesterday. That's executive order number 63, produced by Governor Ralph Northam, and it is an order of public emergency health, and it talks about the requirement to wear face coverings while inside buildings. The reason promulgated for this message and for the particular regulations is because of the fact that a substantial number of people are considered asymptomatic with the novel coronavirus known as COVID-19. There are also people that can spread the virus that do that before they actually have symptoms. So one of the ways that they can help prevent the spread of the virus and help control the spread of it is by having people wearing face coverings. And I think we probably need to make that point right there. You can wear a mask as long as it's not a condition of PPE or personal protective equipment that requires some training, things like that, but a standard surgical mask or any type of face covering, including a bandana, will meet the requirements of the executive order. Let's talk a little bit about where you have to have these face masks, and I'll read this straight from the executive order so we are clear about that. All patrons in the Commonwealth aged 10 and over shall, when entering, exiting, traveling through, and spending time inside the settings listed below, cover their mouth and nose with a face covering as described and recommended by the CDC. And we've just described some of those things. We'll also put a little pictogram up on our written report. Let's talk about the places that it's required. Personal care and personal grooming businesses, all brick and mortar retail businesses, including both essential and non-essential brick and mortar retail businesses, food and beverage establishments, including restaurants, food courts, and alike, and including farmers markets. And this is inside those businesses when those businesses are permitted to reopen for indoor dining, okay? Entertainment or recreation businesses, but not limited to racetracks, historic racetracks, performing arts centers, museums, other indoor entertainment like bowling alleys, skating rinks, and things like that, when they are permitted to reopen to the public. So remember, indoor dining and recreation businesses are still closed to the public at this point based off of the Phase 1 reopening from Governor Northam. We haven't reached Phase 2 yet, where they could possibly open up. All types of public transportation, train stations, bus stations, interstate public transportation, including buses, ride shares, taxis, and things like that, you're going to need to have the face covering. And any other indoor place shared by groups of people who are in close proximity to each other, this restriction does not apply to persons while inside their residence or the personal residence of another, and face coverings may be removed to participate in a religious ritual, okay? And then it talks about state or local government buildings when accessed for the purpose of securing public services, with the exception of students in daycare centers or participating in-person classes in K through 12 education or institutes of higher education. So it talks about those type of things. So it does have some exceptions on there. Let's talk about some of the exceptions. The requirement to wearing a face covering does not apply to the following. 1, while eating or drinking. So if you're trying to eat or drink, it's going to be kind of hard to do that through a face covering, isn't it? 2, individuals exercising or using exercise equipment. 3, any person who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the face covering without assistance. 4, any person seeking to communicate with the hearing impaired and for which the mouth needs to be visible. 5, when temporary removal of the face covering is necessary to secure government or medical services. And 6, persons with health conditions that prohibit wearing a face covering. Nothing in this order shall require the use of a face covering by any person for whom doing so would be contrary to his or her health or safety because of a medical condition. So those are the exceptions that are out there. It talks a little bit about the enforcement, and I know that was a big topic yesterday at the question and answer session for the governor's press conference. Currently, the Virginia Department of Health shall have the authority to enforce this order. So the Virginia Department of Health is the one that does it. The governor made it clear that he didn't want local law enforcement or state police or sheriff's office or anything like that having to issue citations or arrest people or anything like that, because it could come up to a Class 1 misdemeanor, which could lead toward jail time and a heavy fine. He didn't want that. He wanted voluntary cooperation. He wanted an education component to put that together. So the Virginia Department of Health is the agency throughout the state that has the authority to enforce the order. Now, later on, either this week, maybe next week, but soon, the governor did task the Department of Labor and Industry with coming out with a emergency regulation that talks about and governs employees and employers and how that works in the workplace. So that'll be coming out hopefully within the next week or so to do that. When do these orders take effect? This new executive order takes effect at 12 a.m. or midnight on Friday, May 29th. So actually 12 a.m. Friday, May 29th, which is this coming Friday, is when the executive order comes into place. We'll put a copy of the executive order up with our written report so you can read it yourselves. Again, if you have any questions, please feel free to contact us, 540-372-1010. You can contact the Fredericksburg Police Department, their non-emergency number. Or you can contact the Fredericksburg Fire Department as well. We'd be more than glad to try to get you the information and answer any questions that you might have. We'll talk with you soon. Thank you.